I'm Dr. Rick Green, Senior Medical Editor for General Surgery News, and we're coming to you from the annual meeting of the Southeastern Surgical Congress in New Orleans, Louisiana. And it's my great pleasure to talk this morning with Dr. Catherine Morgan, better known as Katie, from the Medical University of South Carolina, where she's Professor of Surgery. Katie, thanks so much for being with us.
Thank you for having me.
So you gave a great talk this morning, the State of the Art lecture, which is an annual lecture for the Southeastern. You gave it on pancreatic disease, which is a very difficult problem of managing pancreatitis. I guess one of the questions I'd like to ask as a follow-up, not all surgeons, not all young surgeons are trained the same. Not all surgeons are trained to take care of severe pancreatitis. What are your thoughts about regionalization of care for patients with severe pancreatitis, acute chronic pancreatitis, because we're not all trained the same?
Yeah, I do think one of the most important things in managing sick patients with pancreatic necrosis is the team, and so it requires members, not just surgeons that are knowledgeable, but it requires gastroenterologists, interventional radiologists, and intensivists that are all experienced with pancreatitis. And so for that reason, mostly, I think regionalization makes sense for the sickest patients with necrosis.
You made some good points also about different techniques that can be used. So I'd like to transition. You deal with residents every day. You teach residents. You know laparoscopic, endoscopic techniques. In the use of the robot today, that's a big issue. And of course, in General Surgery News, we've been writing a lot about robotics. How do you teach residents to use new instrumentation that maybe the attendings don't even know how to use?
Right, I mean, that's a challenge, and we try to have as much curriculum as we can. So for example, with the robot, we have a specific robotic curriculum that the residents go through and try to introduce them to instrumentation and techniques outside the operating room, so that when they go into the operating room and are involved in patient care, it's not new to them. They've had some training beforehand. It's hard though. I mean, there's not a perfect way to do it. I think we still do a lot of graduated responsibility, where not every resident will have the expectation that they will perform as much of every surgery. It's not uniform. It's based on what experience they've had outside the operating room, and what their skill level is and what they're ready for.
Well, I want to congratulate you on the magnificent career that you've had thus far, and also the work that you've done for the Southeastern Surgical Congress. It's been a pleasure to talk today with Dr. Katie Morgan, who is certainly a leader, gave a magnificent talk in the state of the art of acute pancreatitis. So Katie, thanks very much for being with us.
Thank you.